program, we bring to you gynecologists, the doctors that have specialized in women health, the doctors for children, our babies, the pediatricians, the advocates like the sickle cell champion, among others. Every Wednesday, 8-9 p.m. with me, Kamara Daniel. Be there on Google Day Television.
You're most welcome to Google Day Television every Wednesday at 9 p.m. I am Kamara Daniel, your presenter. I want to thank you for loving us and for always watching Google Day Television. And in this very important program, we want to sound a big alarm about hearing. Our ears are often neglected. Our ears are often dirty. Our ears are often, with wax. Some people actually think that they're not hearing. Many people don't know how to clean their ears. But of course, this very year, 2026, and to celebrate the World Hearing Day, we are talking about how best to make sure we're taking hearing from classroom into communities, or vice versa, from communities into classroom, and of course protecting children's ears, making sure that children's ears are safe, clear, and of sound mind. Even amidst these earpods that people put them on and they walk, everywhere, even when you're speaking to them, I usually person don't understand. I'm happy we have an ENT clinician who is going to demystify very important complexities around the World Hearing Day. You're most welcome.
Thank you very much, Mr. Kamara Daniel. I can see my hobby.
Please. No.
Okay, it's okay.
Please introduce yourself to viewers.
My name is Muge Yoko-san, an ENT clinician from Uganda Institute of Allied Health and Management Sciences, Bulago. I currently work there in the ENT clinic in the school, and also in assisting students in getting their skills in ENT.
Wow. My alumni is in things. Now, we want, of course, to make sure that you get this guest very well. We want to talk about World Hearing Day 2026. And of course, we want to center it on the very theme, from communities.
From communities to schools.
To schools.
Hearing care for all children. That's basically.
Please, let's start from there.
Okay, thank you very much, Mr. Kamara, the host, and the viewers. This year, we have the World Hearing Day, 3rd March. I'll give a simple preamble about this World Hearing Day.
Please do.
This World Hearing Day was established initially in 2007 after the International Conference of Hearing Day. And initially, it was named what we call the International Ear Care Day. But later in 2016, it was rebranded a new name called World Hearing Day. This was done in order to emphasize the issue, the global issue of reduced hearing in the world. We've been celebrating this World Hearing Day internationally, and in Uganda, we've been having it. I remember in 2000. Last year we had it at Kayunga Regional Hospital. This time round we are at Kawolo General Hospital in Wipe District on 3rd March this year. Basically, why are we having this World Hearing Day? Number one, we want to ensure that we continue to sell out there about the hearing. There are a lot of things which are causing hearing loss in people, but why this time around, why have we put our focus in children? It is because these are the leaders, actually, the people tomorrow, the new generation. That's why we are basically focusing on the children,
the young people.
And they are in the communities, and others are in school. And why are we looking at communities and school? In the communities where we stay with the children, once a child has hearing loss, let's say at home, you call a child and say, Stephen, Kamara, and Kamara is not responding to you. The next thing will be a slap or a cane. Because Kamara is responding, you may think that the child is stubborn. Then at school, these people are always bullied. They are called deaf, they are called stubborn, they are called they cannot...
different names.
They are called different names.
Basiru.
Basiru, Tevitegera. So we are looking at this from communities, from home up to schools, such that we
integrate
the problem
together.
of
Perfect.
Yeah.
Now, of course, we want to look into what is an ear. Let's first look at the ear.
Oh, okay.
We talk about what it does and where is it located. You know, when you're children, you have to say head and shoulder. I don't know where the ears come from, but where they come from, please let me know. Because I remember the song Head, Shoulder, Knees and Toes, but
shoulder.
where are the ears?
Okay.
Please locate us where the ears are, what do they do, and when does hearing loss come in, and what factors contribute to the hearing loss?
Okay, thank you very much. The first, the ear is the sense organ for hearing. It's located on our head.
On the head.
In the lateral sides of the head, that's where we have the ears. The ear falls under what we call the ear, nose, and throat. It is because these three organs are interconnected. They communicate. The ear communicates the nose and the throat. That's why we always have them under ENT. Once you get a problem with the nose, it can cause issues to the
ear.
Because they have a communication and through what is so-called eustachian tube. So once the nose has issues, let's say an infection or you have flu, that's why sometimes when you get flu, you get issues with the hearing. It is because the eustachian tube has been blocked. It was put there in a way that to create a channel, a drainage from the middle ear. So the ear basically has three parts. It has the auricle, this outer one we can see, the outer ear. The outer ear has the auricle, the one we see, the ear canal, and then the outer portion of the eardrum. Then we have another portion which is the middle ear. That one basically has the inner portion of the eardrum, then it has the ear oscars, then also that drainage tube which we are calling the eustachian tube. Then we go far deep and we go to the what's so-called the inner ear. The inner ear basically, that's where we have the smallest unit of hearing. The structures responsible for hearing, they are inside there. We have the cochlea, and mind you, the hearing has basically two major functions. Though most people think the hearing has only one function. You know, most people think that the ear is there for hearing only.
What else does it do?
The ear, another function for the ear is for the balance. The ear.
How does it do it?
Oh, okay, thank you very much. So the inside, in the inner ear, which is the inner portion of the ear, it has two major small organs there inside. It has the cochlea, responsible for hearing. Then it has the vestibule, responsible for balance. When you're walking, when you're lying, or when you're jumping, it is the vestibule which is responsible for your balance. So once you get issues with the ear, you're most likely to get issues with the balance too. That's why ear care is very important. Very, very important. Though most people in the village, they are all out there. They have taken it lightly and they are not bothered about...
Why did you say in the village? I'm certain even the airlights do not care for the ears.
Okay, out there we say the village, wherever you are, even if you're in Mulago, though it's town, but out there, people out there have taken ears as lightly. So I've said the ear is a sense organ for hearing, very important. And it is also responsible for balance. So we need to take special care about our ears. Let us not, we should not do anything that can cause whatever. So
the ear is basically for two functions, hearing and balancing of the body.
Balancing of the body.
Only. There are no other functions of the ears related to any other things.
Basically, those are the two major functions. Other functions are there. For example, cosmetic. The ears are there for it to look good. For ladies, you even see them putting earrings, but that was not a major function. But I said the two major functions.
You've driven me to another big important point.
Yes.
Now for our sisters who went to pierce the ears, and now they developed big things in the ears.
Okay.
What about them?
Oh, thank you very much for that question. Ladies always get this issue out there, and they have other people call them Ainaka Monde, Arinaka Monde, Ainaka Monde. This is where it comes from. You know, that's where the other third importance comes in. Cosmetic. The ear is there for beauty. Once you don't have the ear, you don't look good. Eh?
You look funny.
You look funny. You look incomplete. Now, ladies go on and add on other things.
Even some
even
boys.
men nowadays, I see them there, but me I don't have. Now, ladies always go there. Actually, they go. I don't know wherever they go, and then put small holes in the pinna. This is a pinna down here.
The whole of this is a pinna.
Yes.
But this is more massecular and this is more of cartilage, right?
Yes. So the ear. So they always put a small hole where they can where they can create a permanent hole for fitting of the pins. So this is what happens. Now around the ear we have this pinna is majorly composed of cartilage. Now the unfortunate part is that once you go to unprofessional people to put that permanent hole there, and should they cause any damage on the cartilage, now the cartilage reacts and it overgrows. That's the so-called decamon that grows on the sides of the ear.
So, oh my goodness, does that affect hearing? How do we relate it to the hearing?
That one does not affect hearing because the so-called decamon, that overgrowth always grow around here, but it does not affect hearing. It is so, though it affects what the so-called cosmetic.
Cosmetic crooks and
you don't look good, by the way. You don't look people always feel stigmatized and actually keep on covering themselves when they are moving. Yet they are the very people who went there when they wanted to clear their hole.
Pierce the ears.
Yes.
Very perfect information from Mr. Eko. I'm so excited that I have you here and I'm learning about important things on the hearing. And now, of course, we want to look into how does hearing loss come about. Let's dive into the factors that bring about hearing loss.
Okay.
And if you have some statistics, maybe, about hearing loss in Uganda, how many people have hearing loss, we can also talk about them.
Okay, thank you very much, West. Before I think we go to the cause of hearing, many people might not know the process of hearing.
Yeah.
Yes, the process of hearing, it just like I've divided the ear into 3 portions, it starts from outside. The pinna is there to collect any sound. Whether when you speak there, this pinna is there to collect sound. Channeled through the canal, and it strikes the eardrum. The layman's language, you call it the eardrum. But for us in ENT and in otolaryngology, we call it the tympanic membrane. So once that tympanic membrane is struck, it vibrates. Now once there is vibration produced, just like you have a drum and you strike on that, bah, it vibrates. So once there is that vibration, it is channeled via the so-called ossicles, mechanically. The ossicles, the malleus, the incus, and the steps.
Yes, at
so
least I remember the 3 bones.
The 3 bones. So once the vibration is produced, it is channeled through mechanically through those bones, the ossicles. From there, goes through a very small window called the oval window and enters into the inner ear. Once they reach the inner ear, there is in the inner ear we have what call it idolytic fluid. That's where it is channeled and the waves moves until they reach the organ of Cott, where we have special cells, special air cells. Those are the ones that initiates the impulse that is connected to the so-called vestibulocochlear nerve and channeled to the brain, and it is interpreted in the brain. That's why I said, as I said, that the ear is not for only hearing but also for balance. Now, vestibulocochlear, and they have 1 nerve. So just imagine if you have a problem in one, that means that they could cause a problem in another one, because the two, the balance and the hearing, they are channeled by 1 nerve, the so-called vestibulocochlear nerve. It is cranial nerve number 8.
Again, cranial nerves?
We shall not go deeper. So he said basically talk about the causes of hearing loss. There are so many causes of hearing loss in the communities, and also others we can have genetic cause, we can have environmental.
Let's talk about the genetics, environmental, and of course other factors. Let's expound them.
Okay, I would start with the commonest mostly we have the environmental. They are very common. Number one, in this generation, we are so exposed to noise. Noise everywhere. Go to the discos. Noise everywhere. People, they can people are exposed to noise from, let's say, from 8 up in the early morning when they are still dancing, but that is loud noise. So just imagine you are exposing your ear cells every day. With the time they get wear off, and you damage your inner ear. Once those ear cells are eroded off, you can no longer hear well. The hearing goes. So that is number one. We have sound in the community where we are living. Be it in the discourse, be it we even have traffic sounds. Every time vehicles are moving. Nowadays we have even these Subarus. When they are some people are driving, you may think they are bullets fired everywhere. Those ones, the more we get exposed to them, the more we get issues with hearing loss.
How about people's sound? Because sometimes downtown people can talk.
By the way, I don't want to talk about the born agains. But sometimes there is a time they over talk. I understand this speaking to God, but sometimes you find a church. My brother, you cannot be able to eat. Every time there is a lot of noise. So there is noise, number one. Number two, we have infections. The ear infections mostly. Let's say, let's start from the outer ear. Otitis externas. Otitis externa means that there is an infection of the external ear.
They used to say that if you have an infection or wound on the ear, you literally lack meat. Is it true? Have you heard about that myth?
You literally lack meat. Those are myths by people.
Have you ever heard about it?
I've actually, I heard it somewhere, but it is not proven anywhere.
In Western Uganda, if you have otitis externa, actually, we believe you are lacking meat.
No. So otitis externa, that is an infection of the outer ear. It can be the pinna in the canal. That is otitis externa. So that infection can even cross and continue to the middle ear and then to the inner ear. Then in the middle ear, otitis, when we have otitis in the middle ear OM. Now, once those infections are there also, first of all, the inner ear the middle ear is made in a way that it should only and only have air. Where we said there are bones, where those oscars.
The steps,
now,
the incus and the majus.
sometimes when there is an infection, whenever there is an infection, there are exudates. Inflammatory mediators are always poured there, and with the time, fluid tend to accumulate in the middle ear. So once there is fluid build up in the middle ear, you will get issues. Sound will not move smoothly or will not flow to the inner ear. So we will get hearing loss. Then the other one is when you get frequent nasal infections. Now, remember I said there is a communication between the nose and the ear. Just imagine when there is an infection in the nose. That means that infection can easily ascend to the middle ear. And as it is ascending, it can even block that eustachian tube that keeps on draining the middle ear. That is infection. We can also have infection is in the inner ear, inside. For example, lambillitis. The lambolith, those are the coverings of the cochlea. Now, once they get infections, someone can get a sensory, because we have basically two types of hearing loss. We have conductive hearing loss. In case the hearing loss, or in case the cause of this hearing loss is in the external ear and the middle ear. Now, once it crosses to the inner ear, someone gets what we call a sensorineural hearing loss. For example, when I said noise can cause erosion of the inner cells, the inner cells, that means that this person who gets noise in this hearing loss, that is a typical sensorineural hearing loss, because the damage is typically in the inner ear. So infection, but we can also have infections that are coming from other parts of the body. Let's say the throat. Commonly, some people are disturbed with the so-called tonsils. When the tonsils swells up and other overgrowth and other outgrowth, like tumors, Let's say people who get nasopharyngeal carcinomas, inverted papillomas, and so others. When those swelling or the masses, when they overgrow, they tend to press on, number one, they can press on the eustachian tube. That means that the tube will be blocked and the sound will not be moving properly. Number two, the tumors can also go and push or erode the inner ear. That means that it will affect or it will damage the organ of which is the area for hearing. Number three, I've so far studied. Number one was noise, which is the sounds. Number two, I talked about infection. Number three, we have other diseases, systematic diseases, hypertension. And now these systematic diseases also have another one, which is the drugs we use. Because sometimes we have systematic diseases, let's say hypertension, and some of the drugs we use in management of hypertension can cause issues with the hearing. The form of hearing that is a form of hearing loss caused by this type of, by the drugs, it is called the drug-induced hearing loss. That one is also a sensorineural hearing loss. For example, and some hypertensive drugs can cause it. Diabetic drugs can cause it. Cancer drugs
can also predispose you to hearing loss.
Can also predispose you to hearing loss.
Okay.
Then there are also other antibiotics. Irrational use of antibiotics. Nowadays you find someone, every time someone gets a small sickness is put on gentamicin. Let me tell the public, gentamicin, any drug containing gentamicin, mostly if you're having an eardrop, gentamicin, an eardrop containing aminoglycoside, for example, gentamicin, neomycin, amikacin, and it is for dropping in the ears. Please, even when a pharmacist or a drug shop is selling it to you, please, you say Musao stopped us from using those drugs because they are ototoxic. And mind you, you find someone, okay, let's say, may be having otitis media. Now, when he goes to the nearby clinic, because mostly we don't have ENT clinics in Uganda, there are few. Now, the nearby clinic, because the clinician wants to take some money, he will prescribe, let's say, Probeta-N and other drugs which contains gentamicin. They are not good, public. Drugs which contains aminoglycosides, they are not good for eardrops. So,
or self-prescription
then,
is dangerous.
Malaria, antimalarials. Way back, we used to, initially people could use quinine. Quinine caused a lot of hearing loss, and people are living with hearing loss because of the quinine. And people could used to just pump 8 hourly. You get to there for about 5 days. So quinine is also among the drugs which can cause hearing loss. So I said the other one is drugs, and actually I combined two. Systematic conditions and also the drugs. Then other causes of hearing loss, we can also have trauma. It might be, for example, today I came in a rush, I jumped on a border. When they knock us and I get an accident, and let's say the accident involved my head, I can get issues with hearing. My hearing system can be damaged. And there are people who are living with that. That's why they always, the government of Uganda and the traffic is always coming up with guidance and say, whenever you're traveling on a border, actually they have told the border people that should have 2 elements. For the person operating the border and also for the passenger who is going, because the head is having very important organs, and one of them is the ear.
I thought the important organs are somewhere. Now, of course, we'll go for a short quick break. When we return, shall discuss more of the reasons why actually hearing loss has increased, focusing more on the earpods. There's so much more on Sarah Manga Dawson. See you shortly.
Okay.
Good Day TV, transforming your life. wayagala ebyuma ebirungi ebyogera basita pasiteri atunda nange ngoma negita zonna basita pasiteri amplifier n'emizindalo basita pasiteri ebitala bya siteji ebyebika byonna basita pasiteri ebyuma bya ivetisi tubirina byonna basita pasiteri awutudo wa screen tupangisa basita pasiteri kukizimbe kya Newmark William Street basita pasiteri kati ndogendayo musajja mwesigwa kituufu endoja gisoboka ekibanja mpola akikwata wagula ebyekkanisa jangu ewa pasita pasiteri
tusangibwa ku kizimbe kya Newmark ku William Street ku ground floor room number N31 opposite DFCU Bank. Essimu noti 782 00 ne noti 752 00 wano wokka we tusangibwa.
Near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxa, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxa, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you.
Gugude TV, transforming your life.
Once again, you're most welcome to Good Vision Health and Beauty program every Wednesday at 9 p.m. I am Kamara Daniel, and of course, we're still talking about World Hearing Day. In bid to commemorate, raise awareness, how best take care of our ears. And just like before we had left, Mr. Eko, a senior ENT personnel, was telling us that the importance of the helmets that the government tells border riders to have 2. One is meant to protect your head because it has ears and other vital organs. And the next issue now I want to talk about the use of the earpods. Literally, if you walked on the streets, out of 10 people, 8 of them have these earpods or earpods. I don't know. They have them in their ears. They are walking, some are listening to music, others are not listening to anything. I don't know if it is a war of fashion. I want us to relate this to the hearing loss.
Okay, thank you very much. First, let's go straight to the earpods. Actually, it's becoming an alarming problem worldwide. Now, you find that 8 in 10 people you find on the road or in the community, mostly where we stay, they have earpods. Either they are using them at that moment or they have them, they use them. Now, let me teach about something small about these earpods. They are not bad, they are good, but the more we use them in the long run, they may cause issues with the hearing. Now, AirPods, most of these ones, the Bluetooth ones, they use what we call microwaves because it's connecting from a source of the music or whatever you're listening to, the source of audio, source of sound, then connecting to the to the chip itself. So these AirPods, they integrate information or messages or sound using what's so-called microwaves. So these microwaves are not good. First of all, one, we have put these chips to the so-called earpods here in the ear, very near to the brain. Now these microwaves, they, I mean the earpods, they are using microwaves. These microwaves produce what we call the free radicals, free oxygen radicals. Now once these free oxygen radicals reaches the brain, they cause alterations. First of all, people who tend to have to use earpods, there are people who are reporting constant headaches in the hospitals. You treat the headache today, the next week the person comes back, the headache is not getting whatever. The person is not improving. Yes. Because the free radicals are fully moving in the brain tissue, and now they are disturbing the brain tissue. Now, pertaining hearing, how do these earpods causes hearing loss? There is what we call, I talked about noise. Now for earpods, for them they produce constant noise to the ears. It may be small, but since it is constant in magnitude, it becomes big. There are people who sleep with earpods now 12 hours from 7 up to morning, the earpods are there. Just imagine you've exposed your ears for 12 hours. There are people when they are traveling in a flight from Uganda, let's say the longest journey is about 14 hours, earpods are here, they are listening to something. So you're exposing your inner cells. We said repeated exposure to sounds. These ears, the ear cells, they get eroded and eventually they get damaged and now the hearing goes down. So people should use those earpods. I'm not saying they should stop because sometimes they help us, but they should regulate on the way they use them. They should regulate. To me, I could recommend if you're using those earpods, you should not exceed 2 hours in a whole day. 2 hours. You should not
2 hours
exceed.
in every day.
In every day.
Wow. Thank you so much. And now, of course, we've looked into the factors that contribute to the hearing loss. And of course, we've also looked into the types of hearing loss. Now, we want to do early diagnosis. How can people tell that this person is having a hearing problem, or I myself am having a hearing issue?
Okay. Thank you very much. When I was talking about the causes of hearing loss, I forgot the most important one. When there is wax or a foreign body in the ear, the hearing goes down. Wax, very common. People have wax down. People have wax in the public out there, and their hearing has gone down. So wax is one of them. Then the other one is when there is a foreign body. Let's say a stone. Once a stone enters there, it can cause hearing loss. Now, you asked me about the early diagnosis. By that, it is very important to always have a routine checkup for the ears.
When should we?
At least in every 3 months. When you don't feel anything, any problem with the ears, at least in every 3 months, visit the ENT and they do ear checkups. Because some people, they only come to us when they have issues. Nowadays I don't hear well. I have sounds. Now, the diagnosis, most of the times, these are some of the common symptoms to tell us that someone has issues with the ears. These are some of the symptoms that people present with in the hospital. Number one, there is reduced hearing, of course. People come with ear blockage. Then there are sounds. People always present with the sounds in the ears. Then number two, there can be a visible discharge from the ear. That means that there is an infection already.
Like water?
Watery, can be pus, can be bloody, can be... when it is watery, it shows that if it is pure water, it shows that there is leakage of the CSF, cerebrospinal fluid. When it is bloody, it means that there is damage in the middle ear or in the inner ear. When it is watery, when it is pus, it shows that there is an infection in the middle ear. So I talked about blockage. Number two, we talk about the discharge. Number three, we are talking about the sounds, the different sounds. Then the way you've been perceiving the information also goes down. You realize that you've been talking to a friend, you've been friends to me, we've been friends for quite a while. And now you realize that nowadays whenever you come talk to me, I keep on coming nearer to you. I keep on bending because I'm trying to bend so as I can listen. I can hear that whatever. Sometimes to realize that these people have hearing loss when you're listening to me, let's say music already at home. These people, they will keep on telling you, can you please increase a little? Adjust such that I can hear. So just know that is what a problem. Also, in the children, how do we get to know that there is reduced hearing or there is hearing loss in children? Number one, if you have a child at home, whenever you call, this child does not respond. The child is not stubborn. The child is not hearing. Now, do you expect me to respond when I'm not hearing? And this is very common. In the village where I come from, when they call you and you don't respond, that the next thing, if the stone is nearby the mother will stone you, or she will cane you. And other people go ahead and they slap. Give a double slap, causing more danger. So, if you have a child at home and the child, whenever you try to call, the child is not responding, just know there is a problem with the hearing. At school, if the child is not improving, by the way, hearing, when a child is not hearing in class, even the performance is going to lower. You realize the child who has been performing well, way back, let's say in primary 1, 2, 3, 4, up to, let's say, P5, the child has been good. Now reaching to, let's say, P6, the child is, the performance is deteriorating. So, you need to look at the hearing also. Is the child able to listen to the teacher? Because sometimes most of the information we understand is the information the teacher always tells us. What we hear is what we most basically understand. So where we are staying, in the communities and at school, let this be a responsibility of parents at home and the teachers at school. Whenever for parents at home, whenever you keep on calling a child and is not responding, just know there is a problem. The child is not stubborn, but the child is having hearing impairment somewhere. So you need to visit any ENT clinician or specialist such that we test or check the hearing. At school, if the student or the child's performance is deteriorating, just know there is a problem with the hearing. The child cannot hear well, so the child is not perceiving what the teacher is saying. So,
wow,
yeah.
Wow. Very interesting signs and symptoms that people should actually look out for. I like the fact that when you said increasing the volume of the radio, coming closer to the person, I doubt this among young people can happen. Of course, what happens in the community is very different from what actually happens in the real world. Of course, hearing remains very important to our bodies. Let's go to prevention. How best do we prevent this? But I want us to focus more on cleaning the ear.
Okay.
Let's talk about how to clean the ear very well. I see people using lids of the pens, car keys. If you have a car, you are the richest person, you have to use your key. I know how big the car keys usually are because, I don't know.
Okay, thank you very much. There was ear care. How do we care for our ears? It is not only cleaning, but how do we care for our ears? Number one, I want to teach the public that the ears are made in a special way. They are but for the ear, basically, the ears are made in a special way. God made them naturally that they clean themselves. That's what, number one, I want to tell the public. The ears clean themselves. They have very important glands inside there, the so-called ceremonous gland. This one, they produce oil-like or jelly-like substance called the cerumen. This cerumen, its importance there, it is to clean the ear. For example, every time we are walking on a judge or we are traveling on a judge, we don't close our ears. So whenever there is escape of dust particles into the ear, this jelly-like substance is there to trap. So once it is trapped, once that dust is trapped, let's say dust or any other foreign body, once it is trapped, it is that jelly, whatever, it keeps on flowing outward. Sometimes some people are not even keen. When you sleep, you realize your bed sheet can get shred where you put the head. It is because that substance was flowing all the night. So it was cleaning itself. That is number one. The ear cleans itself. Now, ear care. Number one, we should avoid exposing our ears to loud sounds for so long. There are people, I understand there are people who are working in factories, but here the human resource managers in this factory should come up with a policy and say people should work for at most 4 hours, 6 hours, where there are loud noises. There are factories, let's say those cement factories where there is a lot of noise, the mills and whatsoever. So at most 6 hours. That's why I encourage them to use the shifts. So we should not expose ourselves to too much noise. Number two, when you're traveling, when I say judge, I always encourage people to have the whatever, the element. It is very important because I said one of the causes is trauma. It is trauma, so it is very important. The other one is that we should not allow anything to enter our ear. There are people who put there anything they want. First of all, you're using a car key. A car key may have some sharp endings which can traumatize around the canal, and you don't know the depth. Most people, they don't know the anatomy of the canal. The canal is just 2.4 millimeters. 2.4 centimeters. Those are just 24 millimeters. So you're using a car key which is about 3 centimeters long. So as you're pushing, before you don't know how deep you're going, so by the end of it, you will damage the eardrum. And the eardrum is a key part in hearing. It plays a very big part because once there is no vibration, you cannot be able to hear. So we should be very cautious about what we put in the ears. So
how about the earpads?
So earpads. The earpads or the earbuds, the one they use it for cleaning?
Yes, the earpads, also earbuds, whatsoever.
Okay. So most people, nowadays I always see people with the ear. For me, I call them cotton buds. They use them for cleaning. Now let me teach you something small before I leave this life. Now, whenever you use those cotton buds, they are made in a ball like whatever, on a stick. So whenever you keep on rotating the ear canal, what you're doing is, because I said that this substance is constantly produced to ensure that that gel-like substance is there to trap dust and whatsoever. So it is lining the saccular canal, the saccular walls of the canal. So for you, as you're rotating in the ear, you're instead of collecting it around the ear and you're packing. Have you ever packed mice in a sack? That is what we always do. So people always use cotton buds. After 2-3 months, they always come to us and say, I no longer hear nowadays. My ears are blocked. Why? The person has been collecting all the semen around, and it keeps on packing itself inside. Then the other thing is that these earpods sometimes, even if a smaller piece of cotton leaves that ear, the cotton buds, and remains in the ear canal, and it is too sensitive for it will assume that there is a foreign body in it. So it will produce too much of the other substance, and when it is too much, it becomes a problem and it gets impacted there, and it blocks, causing the so-called that wax there, it causes wax impaction, which causes conductive hearing loss. So I don't encourage people to use those cotton earbuds.
Wow.
They're doing more harm than good.
Thank you so much, Mr. Eko. For our viewers, want to thank you so much. You've been so good since we started this program till now. Now, of course, we are in the last bits. We want to learn how best to clean the ears. You've discouraged us to use our car keys, yet we bought our cars on our own. You've discouraged us to use the pen, leads, and the earbuds. What else should we use now? How should we use? What should we use? And when should we clean our ears?
Okay. Thank you very much, Mr. Kamara. Actually, the only way we can do some cleaning of the ear, it is the only portion you have to clean. It is the outer ear until the concha here. You see there is a depression around here. Beyond that, don't clean your ear. Don't touch even there. So when you feel that you're uncomfortable with the ear, what you can do, you get the little finger. I know the little finger cannot go beyond that whatever. So you get your little finger and press it in this depression and you rotate. you realize that even if it is some bit of too much of the other substance, you will see it coming out. You will see it pasted on the finger. That is the only thing I recommend you to use. Use your little finger, rub it around the depression in the pinna, that whatever will come out. But beyond that, don't clean. If you feel you are uncomfortable with your ear, please visit the ENT. Because first of all, when the ENTs are doing the checkup, in the ear, first of all, it is dark. You cannot see there without your eyes. I mean without light. So in the ENT, when you come to the ENT clinic, we always do what we call otoscopy. We look into that ear using the light. So for us, we are seeing what is there. But for you, as you're putting your car key and the other sticks, you cannot see. You may instead cause more damage. So cleaning, use the little finger. That's what we recommend. You wash, when you're bathing, just put the little finger around here, leave the rest. We should not go beyond that part.
Wow. Thank you so much, Mr. Eko. In a bid to conclude this very important program, tell us about the few treatments for the ears that are available and where can we have the ENT services from?
Okay. Thank you very much. Where are the ENT services in Uganda? Currently, in the Ministry of Health, it is provided at the regional referral hospital. Every regional referral hospital in Uganda has an ENT department. Then at the National Referral Hospital Mulago, we happen to have 2 clinics. One in New Mulago at Block G level 5. Opposite I, we have ENT clinic. This clinic runs, the weekly program is that on Monday they see all the patients, whether you have ear problem, nose and throat. On a Tuesday, we only see children, pediatrics, children with concerns with the ear, nose and throat. On Wednesday, that is otology day. That is the day we see all the people with the concerns of the ear.
Only the ear?
Only the ear. We gave it a special day on Wednesday.
Every Wednesday?
Every Wednesday of the week at the ENT clinic, New Mulago. Then on Thursday, we look at the nose only. Those who are having issues sneezing, the ear blocked, they are congested, I don't breathe well, I do what, I snore, come on a Wednesday, on a Thursday in an ENT clinic, New Mulago. On Friday, general. We have any issue with the ear, nose and throat, we can see you. Then in Old Mulago, for which they don't have a program. The way you come, the way you present, the way they treat you. It is located in Old Mulago, just opposite the dental people. They are very near to the eye. Then we have also started another ENT clinic at the ENT clinic, the only ENT school in Uganda which teaches the ENT clinic officers. We realized that there are very few ENT specialists in Uganda. Most of ENT has been on that specialist level. You have done a bachelor's in medicine and surgery. After that, you go specialist for 4 years and become an ENT surgeon. Of which those people are still very few. They cannot reach my people in Kamuli, where I come from. I come from Busoga. Down there in Busiva, Kamuli municipality. That's where I come. So we realized the government realized that there are few surgeons, and so they have extended this program to the diploma level. Those direct from senior 6 for 3 years, and those who are coming with another diploma, let's say clinical medicine, lesson dancing, or midwifery, they study for only 1.5 years. So has to expand the activities out there. So we have started that clinic also in school. One for learning, and also the other one is also to relieve the burden at the national referral clinics, because there are only 2 and they tend to get a lot of patients. So I'm informing the public here that we have an ENT clinic in the school in the school of ENT, Uganda Institute of Allied Health and Management Sciences, Mulago. For those who always go to Cancer Institute, immediately after entering the main gate, the next gate, which has Tutors College, that's where we are located. We always see patients from Monday up to Friday, from 8 a.m. up to 4.
Every day?
Every day we are always there to receive patients, because we want to relieve the big burden in the new ENT clinics in the New Mulago and the Old Mulago.
Wow, perfect. That's excellent. And of course, we've been talking about World Hearing Day 2026. Of course, rallying about from community's classroom, looking at what actually transpires at the household level and transforming it into a classroom and how best you can protect the children. But of course, and the community at large. Give us your last conclusion remark about this topic.
Okay, basically, I want to basically go and hint about this day in particular.
Just give us your last remark.
The last one.
Yes.
3rd March, it will be this coming Tuesday. We are inviting the public. We are hosting the World Hearing Day at Kawolo General Hospital in Buyikwe District. For all people who have concerns to do with the hearing or with the ear, please come and join us. We give you free services which include ear checkups, examination, treatment of any ear problem. Then there is another program of giving hearing aids to those people who have lost hearing. So long as you have updated hearing test, the PTA, and you fit to get an hearing aid. Then we shall have more other screening, and also we shall have sensitizing the public about hearing and hearing care in the country.
Wow, thank you so much, and of course we want to thank you for watching Good Television from when we started up to this very important point. I want to thank you for learning with us about hearing. Let's drive this from theory into practice. We screen our ears every 3 months, once 3 months, and of course avoid the noisy places. Ensure that we visit the ENT clinics in case you feel you're not hearing well early enough, so that you avoid the whole problem of getting permanent hearing loss. We urge you to follow our social media platforms, Google Television, LinkedIn, Facebook, Twitter, LinkedIn, so that you can follow this important program, but also share it to your friends so that they can learn more with us. I am Kamara Daniel. Hope to see you next week Wednesday. Bye-bye.
Good Day TV, transforming your life. Tosubwa Good Day TV.
Nkusaamu ekitiibwa ate n'enkulimba, nkusaamu ekitiibwa ate n'enkuvuma ng'abaana bali awo bawulira.
Omukyala wa nkizo mu nkulaakulana y'eggwanga.
Abakyala twenyigire mu by'enfuga y'ekitundu kyaffe.
Waliwo n'enjogera egamba nti bw'osomesa omukyala oba osomesezza ggwanga.
Abakyala tusanyuka nnyo